Morning, everyone. This is Christopher G. Gripe. Can you hear me? Just someone shake your head. Thank you. First of all, good morning, everyone. Hope everyone is doing well today. Welcome to the Family Provider Information. As I said before, I'm Christopher D. Gripe, the Vice Chair of the Brooklyn DD Council. Before we start any procedures and regular business, I'd like to remind everyone with housekeeping rules because we do need to follow that procedure on any council and any meeting you go to. This is available. This is always rules by the Robert Rules of Order. As a reminder, everyone's microphone should be unmuted unless you are the chair, co-chair, vice chair. That's the only time you can actually come in or interrupt. Or if you're an agency, please let us know on the chat as well. So therefore, communication can be entering the meeting room. As a reminder to everyone, cameras are available. This meeting is recorded at all times, and it is recorded in both directions. And words can be added in. So say like you realize you muted, but you don't realize your words are saying whatever you want to say. It's duty noted. As someone's coming in from 2023, and I necrolize that woman's face right there, famous person. First of all, I want to remind everyone as you're coming in, the microphones are muted for a reason, and automatically they should be muted at all times. Hand raise are available as well as the chat box. So if you want to put your comments, questions, please do that or raise your hand. You do have those options. If you need the caption, please let me know so I can turn it on. Or press the more button, which is in your area, to click on the caption. If the caption is acting up, please let the host know, which is me, and I will proceed with that. I remind you, questions, please raise your hand or put your comments into the chat. As a reminder to everyone, let's please follow these rules and regulations. I do want to welcome, as a lot of people are coming in now, and I'm just going to give them a second to admit them in, as they know that we do start exactly at 10 a.m. sharp. Remind them as well as they're coming in and putting on their microphones, they must be on muted at all times in the meeting. And if systems may be having a little difficult, because I can tell Wi-Fi has been going in and out, we see it, we know. So I'm going to remind everyone, please make sure do your part of keeping those muted so we can hear everyone clearly as a crystal bell. And a reminder, everyone, if you have announcements, agencies or elected officials, if you have announcements, please put that in the chat. If you cannot put your name into the system because you may have just rushed in, and as a reminder, as you're coming in, I just heard somebody sniffing. Mute, please. Thank you. And I'm going to proceed as some of you guys are just coming in. We want to welcome them. And I know they're having a little difficult with Wi-Fi. So don't worry. We know you're here. First of all, I'd like to remind everyone, welcome to the Family and Provider Information Committee. This is representing parents and agencies as well, and providers, which the agencies and providers are the same. Fortunately, Rose Sal could not be with us, so you do see me here today, Christopher D. Greif, the Vice Chair of the Brooklyn DD Council, and want to welcome everyone to this meeting at this time. I'd like to introduce our other co-chair who works with Rose Sal, Ms. Deborah Greif. Deborah, can you please unmute yourself and say good morning?
Good morning, everyone. Thank you for coming. I appreciate everyone's presence. Thank you. And now, since I am the co-chair, I want to, first, as I said, hope everyone's doing well. We know there's certain issues with Wi-Fi. We understand that. We ask that if you have announcements or important information services for your agency, please put it in the chat so we can have it. I also want everyone to understand that this is a subject today, as you know, we're going to be talking about the Family Support Service, Family Reimbursement, what is allowed and what's not allowed, non-allowable items. It was updated on February 15, 2023. Now, I want you to also understand that the local, we are in Region 4. right now. Region 4, as well as all the other regions, we did not change how the reimbursement program is. That was designed and set up by Albany Central Office. There's been a lot of issues and problems, so that is why we are going to be discussing this topic. And we know that we're having someone from Region 4 to be discussing this. I do see Janet Davis from Manhattan. She's a family support coordinator, and also Brooklyn's family support coordinator at Angela Blades. But before we do this, I want to, because this is going to be a very intense subject to talk about, I wanted to start, and I'm changing a little bit of the agenda. I want the announcements to go first. So then we can just pay attention only to the subject, the issue of the update, allowable, non-allowable items on the Family Support Service Reimbursement Program. So with that, if you have an announcement, please raise your hand so that we can call on you.
Co-parent, just to let you know, we also have been welcomed by Robin Mooney, also from Region 4.
Oh, welcome, Robin. I just want to get
Yes.
the basic announcements out of the way because I want to then really have a good discussion about the changes to the reimbursement program. So in the chat, I know, does any agency person here? I saw Nick from PHP. I saw, let's see, I know we have from Care Design, Marilee Sanchez. So everyone's just saying, if morning, I see a hand raised. Okay. Who raised their hand?
Give me 1 second, Madam Chair, because you're giving.
I'm giving everybody
That
time.
will be Miss Richardson. Can you please unmute yourself and you can go ahead to do your announcements?
Good morning, everybody. Thank you. I will put everything, I know you have it, but I'm just going to reiterate and put our upcoming announcement. My name is Dayton Richardson from Brooklyn Public Library Inclusive Services, and we have some upcoming programs that I would like to share with everyone. It's a lot, so I'm going to take it and I'm going to put it in the chat. If anyone has any questions or need more information about it, they can always contact my supervisor, Carrie Banks, and I will also put her information in the chat. Thank you.
Thank you very much. I appreciate that. Okay, does any other agency person have an announcement?
Hello, it's
Hi,
Nick from Partners Health Plan. How are you? Good morning.
I'm well. Good to see you, Nick. Haven't seen you for a little while, but that's okay. But glad to see you. And your announcement.
Year so far, and for Partners Health Plan, we started a new program. Our members who live this.
You're going in and out, Nick. I know there's an issue with the Wi-Fi. Can you start again?
Nick, this is Chris. We do not hear you.
Can't hear you, Nick.
Nick, you're going in and out on your Wi-Fi. Your Wi-Fi is going low and then it just terminated.
We can't
And
hear.
another nice thing about our OTC card is it could be used to order healthy foods.
Okay.
So
We
it's a
didn't
nice
hear.
new benefit that we have for people. Can you hear me?
Only you're going in and I heard it over the counter card that could be also used to purchase food because you have a new program. Is that what you just said?
Yeah, I guess it looks like it's my connection that's not doing so well.
Okay. Can you type it into the chat for us, please? Okay. Yes. Okay. Well, Nick is having a little technical difficulties. Unfortunately, it's been happening because of we have to accept the storms that are coming in from the West Coast, the change in weather, and also all the work they're doing around the area. Nick, we didn't hear everything you said. unfortunately, because you're going in and out. So if you can type it into the chat and also email the advisory council, and we'd really appreciate that. And we can then put that on the website. So I appreciate that you have a new program. Thank you, Nick. Is there anybody else who has an announcement? Okay. Here comes Doris. Doris always will have an announcement when we see she's in. Good morning, Doris Khan. I see that you just came in.
Madam Chair, please give her a second to load in, please. I do want to.
Sir.
Yeah,
I am,
do.
sir.
Yeah. Yeah, I see it. Give her a second to load in. Just to remind everyone, if you want your announcements to also go to the website, I remind everyone to please email all your announcements to the bfssac@yahoo.com, which goes to the advisory email, and it goes right to the to the DD Council as well. I'm going to remind everyone that is very strongly, because some of you have said they email and we find out you're sending them to the wrong email. The email that you see on the screen is correct. Please make sure you write that down, and it's duty noted into the meeting. Madam Chair, also just letting you know, we do have the group here as well.
Very good.
So the attendance number is incorrect. The number is now, we're up to attendance of 40 people.
Very good. I also want to explain something, before we go on, and this has to do with the emailing. The Brooklyn DD Council does not have their own website. We at the Family Support, which I am chair, we do help the Brooklyn DD Council by putting their information on the Brooklyn Family Support Service Advisory's website. So please do not try to email the Brooklyn DD Council. They do not have a website. It's the Advisory Council for Brooklyn that has it. So please understand, we're helping them. Okay, now Chris, what do you need to say?
That's done. It's duty noted. Dolores Khan, if you can get your microphone on, we're up to announcements, so we can then go to the reimbursement procedure. So I am asking if you have an announcement, can you please, unless you're having microphone issues? Madam Chair, I think we have to come back once we get the her microphone back. So let's just go on. And
all right, you can Doris, please put it in the chat. We'd appreciate it. Thank you. Okay, now we are going to now go on to, since nobody else has raised their hands for announcements, we are now going to, I know we have a few, I'm going to put it this way. Is it Janet, Robin, or Angela who'll be explaining the new family support reimbursement program? So, because I want everyone to know that there has been major changes to it. I know that there has been issues, so I'd like to know who will be the one going through the changes for OPWDD. It stands for Office for People with Developmental Disabilities. This is a family support service, family reimbursement, allowable, non-allowable items. It's been updated from 2/15/23. My other also question too, and I'm asking, is a very important question. Could you also, when you're explaining what's allowable and what's not allowable, we do have families who've been using, they're on self-direction, and we have gotten their calls asking what can be done or not. We know that we're family support. So I'd appreciate also if you, in your presentation, also explain what is allowed or not allowed if you also have self-direction and the child is living at home with the parent. So without further, who will be the one doing the presentation? Can you please unmute yourself? I'd appreciate it. Thank you. Okay. Christopher, do me a favor, put the list up of what's allowable and not. Okay, we're having little issues with people coming in and out. All right. Okay,
Deborah,
Yes.
Deborah, it's Janet.
Hi.
We can't officially have a presentation because it hasn't been approved by Albany, but
Yeah.
the list up is good. And if anybody has questions, Angela, Robin, or myself can respond to them.
Right. Yeah, we know that still that everything is not completely because we're still in a is that Robin?
This is Robin here. We're
Robin.
still, there's going to be a training by central office, but we're not authorized, to do a presentation about family reimbursement, but we can answer any questions that you have regarding this.
Oh, that's good. But okay, I'm going to.
I believe that you received an email yesterday from, regarding that. I hope
Yes,
you
we
received
did.
it. Okay.
Well, we did, but now this is a very important question I'm having because yes, I did take training many years ago for the self-determination, but I'm not a broker because I realized the program was not appropriate for my child. But I get constant parents complaining to me about they have self-determination. Why can't they use reimbursement? Is there a way you can just give an explanation, a basic explanation, so that this would be a big help to us too, because as I am a parent and I understand we're advisory. I just advise everyone, but I do not. I hope you understand what I'm saying. I'm not going. I can't be responsible for any parent or professional thinks I know everything. I don't. Everything is being updated and changed around for reimbursement as well as other programs. But for self-direction, can you explain what are they allowed to apply for or not? Thank you.
I could try to respond to that. That's kind of a false statement, Deborah, and I hear it over and over again. What it is self-direction pays for certain things. And
Yes.
if what the family is requesting can be paid for through self-direction, it will not be paid for through family reimbursement. On the other hand, if it does not get paid for by self-direction, there's a possibility that family reimbursement will pick up that tab. However, it has to be built into the budget. So if the parent is asking for something unusual and self-direction will not pay for it, it has to be stated in the budget that there's a little space for family support services and a certain amount of money. And we could possibly approve it, but it goes like everything else. It has to go onto a tracker. It has to go to the agency. It has to go to the DDRO, and it goes back down to the family, whether it was approved or not. So yes, it is possible to receive family support dollars, even if you have self-direction. I'll give you an example. Camp is covered by self-direction. Therefore, if someone puts in for camp, we will not approve it. Also, we're not permitted to give more than. So if self-direction will pay for $4,000 of camp and the bill is $8,000, we are not able to give more. Once it's partially paid for, we cannot give more. So it would be denied as far as camp under self-direction if it came to us. Does that help, Deborah?
Yes, it does. Because I do tell families that, and if I'm wrong, please tell me. Okay? That's why I'm asking these questions, not because I don't know it all. I understand that. So first of all, one thing is if the child's receiving self-direction, they have to live at home with mom and dad in a family setting. That's correct. Number two, it has to be, if you're not sure and you're not the child's broker, you need to talk to the broker. Am I correct about that?
Correct.
Yes.
Okay. I've been saying that to the families. And I know they're frustrated, but I don't run self-direction. I'm following the regulations that have been put out by OPWDD. So I hope you understand why I'm asking these things. Because I try to explain to people. It says, we are the Brooklyn Family Support Service Advisory. That means we advise you if there are issues or problems. So that's why I'm asking some of these things with self-direction. I don't know what else to ask, or
No, you're asking the right questions, and a lot of people are confused. You're not the only one. This is a new process for us also, as it is with the agencies. So we take things a little slower than we ever have before. But if anyone is really questioning what self-direction pays for, then the family really needs to go to their broker, really needs to go to the self-direction unit to find out, will this be covered under self-direction? And if it's not, then there's a possibility, and I use the word possibility, that it could be approved with family support dollars, but those dollars have to be added to the budget. It has to be included. A lot of parents don't say that they're in self-direction and ask for something. When we look it up, we see that they are in self-direction, but that amount of money has not been included in the budget. So it has to be denied until it is included in the budget, and then we will look at it.
And once the budget is amended, that has to go, I believe, to the DDRO
It
for
does, and
approval.
it's
And that can
taking
take an additional 4 to 6 weeks or more,
yeah,
from
it's
what I
taking
understand.
yeah. So this quick turnaround time, we don't have it the way we used to. We're
That part
trying
I
the best.
understand. Now, just asking, at a different time, can you email me the updated list for the Brooklyn and also the other 4 boroughs of their self-direction units, the email addresses, so I can, because when a parent, because sometimes they do get parents whose children may go to school, they live in the Bronx, but the child comes to Brooklyn. I do explain they have to go through their own local borough. But this way, I would have the right information on our website to also send to them so they know, because I still get parents saying, but my child goes here. I said, but if you live in Bronx, it's different. Am I right on that too?
Deborah, excuse me, what is it that you're asking for specifically?
The email addresses for each of the self-direction units.
Oh, sure, we can get that to you, of
Region
course.
4. In Region 4. This way, I give the families the email addresses, and I give them, and I said, this is who you should be contacting. With your broker, if you don't have a broker, or you're the broker, you need to talk to the one where you live in New York City. Did I say that correctly?
Yes.
That's okay. The other question, I know this has been brought to me, and then I will let others ask, but this is important too. I have some parents, the children, because of intense issues with their, whatever the developmental ability is, New York State does not have them live at home with their family. Why can't I get family support reimbursement if my child is going to a residential school at, say, Pennsylvania or Massachusetts? What are the rules for that, please?
The rules for that are that if a child is in a residential environment away from home, they are not able to take advantage of family support services. That is the way it is. And parents have, and Deborah, parents have asked, but my child comes home for the summer, or my child comes home for the weekends. Unfortunately, at this point, the rule is that if a child is in a residential environment other than the home, they cannot get family support, family reimbursement.
And one other thing, if child's living at home full time, and they don't have a care coordinator and with a so-called written life plan, can they still qualify for reimbursement?
Yes, if a child does not have the waiver, which is when you would get a life plan, yes, they can get the family reimbursement, and they would not have to have a justification in the life plan because a life plan doesn't exist. But they would have to have a justification along with why they need that item or service. So the answer is yes. If you don't have waiver and you don't have a life plan, you still can get family reimbursement.
Thank you, Janet. I appreciate it. Robin, I'm also thanking you too for answering, because I am making sure that I want you both, everybody, even Angel, know I don't try to answer questions that I'm not sure of. And I know I do read up on all the services, but changes come, and to a point where you can't keep up with everything. So I thank you for answering. Now, okay, do I have anybody have any questions?
We do have questions in the chat that we have from the group that is keeping their chat private. So I am
Yes.
I'm not going to use their name by
Please
law.
don't.
So I do need to, and also before we proceed, some of you have been unmuting yourself. Unless you're not the DDRO, please keep your microphones muted. They're going to remind everyone that many times. So I'm right now going to click over to the chat. I'm going to move over to the chat, but I'm also going to put the question right here. If anyone has any question, please raise your hand or please put the thing into the chat. I am going to start with the chat first. And this is for actually anyone who can answer this in the DDRO. The question number one is asking about, and I'm going to reverse back. Can you explain what all the yellow highlighted means, please?
That's a simple answer. Those are the new items or services that have been added to the allowable and non-allowable. So if someone is familiar with the old list, this is an updated list and they highlighted the new additions in yellow.
And I think you just answered that question number two, Janet, but just to be clarified, so all these yellows are the ones that they can get reimbursed. Am I correct?
Only if they're on the
No,
allowable list.
no, there are two different.
I'm sorry,
There are
guys.
two
Two people speaking. Can one person speak? Because it's very hard to keep track of the words you're saying.
Okay, there are
Sorry.
two different lists. On the left is an allowable list, and on the right is a non-allowable. The things on the right are not allowable as far as getting any reimbursement. So the highlighted are what's new to each list. So what's highlighted in yellow in the allowable are the new additions, and what's highlighted in the non-allowable are the new things that they've put on the list that are not permitted to be getting reimbursement for. Okay? So they're two distinct lists there, but the items in yellow are the new items or services under each list.
Thank you, Janet. Robin, did you want to add something? Because just want to make sure, because I heard you saying something.
No, that's what I was going to say. I didn't know who was answering or not.
I know the feeling. I know the feeling. At least we're all getting answers. Let me get to the third question. And then I know that one other person has a question on the chat that you guys can actually see it as well. The other question is if once I put the reimbursement in to an agency, why does it take over 1 year to get the reimbursement?
That's unusual. I don't know specifically what that situation is. It is taking a little bit of time because it's a new process for everybody. So if we're getting an item or a service that's not on this list, it has to go up to Albany. And then once they review it, it comes back to us, it gets back to the agency, and then finally gets back to the family. But a year is way too long. I'm not sure. Whoever asked that question may want to call their family support coordinator in the borough and ask that question, look into it.
And
It
I
shouldn't
just
be
wrote,
taking
and
that long.
I
It shouldn't be
just
taking that long. Like I said, Christopher, like
Yeah.
Janet said, it shouldn't be taking that long and they should reach out to us. But there's sometimes there are delays because if they don't have the appropriate documentation or justification from the family, they may need to request that. And that takes more time to get that in place.
Mhm.
Thank you.
No, thank you, ladies. I'm gonna go to this next question here. It's actually in the chat here, ladies. You can see it from here. I would appreciate your putting up the whatever she wrote. However, see the list. Is it the print it too small?
The font is too small. It's very hard to get this larger. And we can't enlarge.
Sometimes we don't have these. I don't know what.
This
Excuse
list,
me?
if somebody
Okay.
if somebody Googles OPWDD and goes into Family Support Services Family Reimbursement, they will see this list. It's on the OPWDD site. Certainly, they can call and a family support coordinator to find out about an item or whatever, an agency. But it is on the internet. It can be found. In
Okay.
fact, Christopher and Deborah, do you send things out to your families and all? Because what you could do is
Yes, we
you have
do,
a copy
Janet.
of this. What?
Yes.
Yeah. I'm sorry to interrupt you, Janet. This is Chris. Just to make this clear for the record, that was sent out same time we sent out the email. So I am going to remind everyone we did send this out, and when we
Okay.
did send out the joint meeting minutes summary, it was also attached. Now I'm going to
Great.
I just want to make that very clear, and I apologize, Janet, for interrupting you. But
No, they can
Okay.
get it on the internet. If they have a problem, reach out to someone.
All right. Excuse me, Janet and Chris, Lori Rosenfeld. I'm not texting you back because my phone is not working at the moment. But I want to say the font right now on this on the computer and your phone is small. We cannot make it any larger. And I know that you go through the phone. You're going to have to do some form of magnifying. We cannot make it. This is how it was sent to us. And we cannot get it any larger. I know it's frustrating, but all the items that are on the left are the allowable. Then on the other side is non-allowable. But we cannot make this any larger. It will not fit on the screen. I understand the frustration, but we will also be requesting, and Laura, you are a member of the advisory, we're going to be asking, I know there's going to be trainings on what's allowable and what's not, and also how to fill the family support reimbursement. We are also, the statewide committee is asking for also parent gear training because this is so intense. Because even though you may have a care coordinator, it'll help you fill it out. It is extremely important that the parents understand how to do the form themselves too, to make sure, because this is for your child and you know your child the best. So thank you, Jan. I'm sorry to interrupt, and Lori, please understand, if I could make this larger, I would love it too. But right now we may not. It can't be done. We tried.
I also wanted, Madam Chair, this is Vice Chair Greif. Just letting everyone know. Thank you, Angela, to answer that question in the chat. But that is a very important thing because that's been an issue also, and that's all I'm going to say. So thank you, Angela, to answering also in the chat as well on that. I want to
Thank
remind,
you, Angela,
and
too.
can
I
I
want to
just
thank you too. Go ahead.
yeah. Let me get back to the private section chat. And also before I do that, does anyone have a question? Please raise your hand as well. And you can
Okay.
ask as well. So I just want
Sorry,
to make
Chris. May I interrupt one quick second?
go ahead.
Okay. I'm listening to this conversation, and the question was about some furniture and things like that. If the person would like to email me at angela.blades@opwdd, I will forward the list so they have it on hand. But also remember that this list that they have here is not going to be the same that is on the application because there's been several changes since that time. So if you email me, I can follow up. If you have any questions about the family support services and the reimbursement, please email us and we can follow up and assist you.
Thank you, Angela. It's Debbie. I appreciate you saying that. Thank you very much. Okay. Christopher? Angela,
Yeah. This is Chris.
Go ahead.
I'm here. But I am going to remind people, please use your hand raise procedure. Therefore, if you're going, because some people have been unmuting without announcing themselves. Angela, Janet, and Robin, don't worry about that. But I am going to remind people, if you have a question, please raise your hand. Right now, the question right now is, I'm going to back to the chat since there's no hand raise. And I'm just going to put that up for a second. And I'm going to move on to the questions. Okay, first of all, I'm going to the private section, then I'll come back to that. First question is I think, Angela, you already answered that question. I thank you. The second question is, how can we get, okay, someone's unmuting themselves, so I'm hearing echo. And it's not, nope. Okay, here we go. The second question is to reach out to your reimbursement coordinators. Is there a list on emails to them? I think Angela just answered one question for Brooklyn, but I'm going to answer this question. If it's a borough, please let us know which borough are you talking about, because each borough has a coordinator and each county of the DDRO. So I hope that answer is Janet or Angela or Robin want to back me up on something.
I put my email address in the chat for Manhattan.
Janet, do
If
you
they
know?
email us, we will forward it to the correct borough. That's not a problem. So any one of us,
Angela.
we do keep in touch.
Thank you very much, Andrew. I appreciate that
And
very
Janet.
much. And Jen, I appreciate both of you because we do get families from other boroughs, so I appreciate so much.
And thank you, Robin, also putting your email there. All that person saying thank you. Okay, let me get back up to, there was questions into the chat that was I'm trying to get back on. They were asking the reimbursement money, is it going up to $3,000? And whoever's 2023, and I'm guessing this has got to be someone I know.
That's me. That's me. I don't know why it's saying 2023. I'm trying to change it, but
You can't. No,
I,
Robin.
I
you
haven't been
can't.
on Ring Central before, so I don't know.
Robin. The reason is they can't. We don't. The new systems don't let you change your name because that's why.
Oh, okay.
It's a long story to explain.
Okay.
No, there was
Well,
another
that's me.
2020. Oh no, there's another 2023.
Oh, you're
I know.
right. I see that.
Yeah.
Yeah. Okay.
No, I see your face. I can recognize you.
Chris, as far as camps,
Yeah.
there's a $3,000 cap for everything unless there's an emergency situation, which will be dealt with on each individual basis. But camps can be reimbursed up to $3,000. However, if it's a waiver camp, they have to use waiver hours to pay for the camp, and we can supplement any of the costs. So if the waiver hours are used and you're getting a bill for additional charges that the camp is charging other than the waiver hours, we are not able to pay for those additional hours at this point. So if you have waiver and it's a waiver camp, you have to use your waiver hours. If you have waiver and you don't go to a waiver camp, yes, you could use family reimbursement dollars up to $3,000.
Thank you for answering that. I appreciate that.
And again, let me just add one thing. Again, if it's self-direction, they pay, I think it's a $4,000 up to camp. But once we've gotten someone paying something, we're not allowed to pay additional. So if it's a $7,000 bill for camp and self-direction pays $4,000, we cannot pay the additional $3,000. We do not pay more than what was originally paid by an agency or OPWDD or anything.
Thank you. I appreciate that. But I'm going to repeat this, Chris, before you go back on. I want to think that one, we definitely are going to have to do a specific training for families to understand the difference of how to fill out the form. 2, if you have self-direction, where you're supposed to go to check first. And also and I know everything's going to be evolving, but see, sometimes I've been at both trainings and it can go above certain parents' head. I'm very used to OPWDD training, but I would love also to have trainings geared toward the parents too, so that we know how to fill out the form correctly. It's also one other thing that we've all forgotten to say, and I'm going to say it. Reimbursement is not an entitlement program. It doesn't mean you are entitled to get reimbursed. It's a good program, but it's not an entitlement program. Am I correct, Janet, Robin,
Yes.
and Andrew? Because I understand that I'm not going to get reimbursed every year for my child. And I want everybody to understand that, yes, we need help. It's expensive to be a parent of a child with developmental disabilities, but at the same time, there's only so much funding and money, and we also need to share with everybody. So I'm bringing that point up because I don't want to be yelled. Well, we are parents. Yes, we're parents. Yes, it's very difficult and hard, but we also have more need than we have enough funding for services. Okay, Christopher, please go on to the other questions.
At this moment, the only question I just put into the chat for the ladies, if Angela, Robin, and Janet, can you please redo your email address again?
We
Yes.
appreciate it. Thank you so much for doing it.
Because that's one question somebody just asked. Because every time they're trying to look at your email, everyone's putting in their questions and they lost place with two. Actually, Robin, they have yours, but Angela and Janet's. But thank you again, Robin, on that. The other question is, and I think the co-chair mentioned it already. That question about the trainings. Is there a way that we can get when you guys are doing the trainings? Can you find out when the dates are?
We
Yeah, we
believe
can look into that.
Oh, I'm
Yeah.
sorry. Say that again.
we can look into that, Janet said. Right,
Oh.
Janet?
Yes.
I heard Robin too. I was like, wow.
Robin, thank you. And Angela, too, thank you.
Yeah.
Because I want everybody to also understand, because in the past, yeah, I could fill out the form because I understood. And I also knew how to write out a justification letter. But now, because it has to also be in the life plan, except if your child does not have a waiver, has any waiver or care coordinator, but we still have to write correct justification letters. So we will need training on the right way to write this down, what kind of receipts are allowed or not allowed. Because you may say yes to the item, but what kind of receipts do you want us to give to you? Because I know that and I've told families in the past, like your child needs specialized clothing. Going to a store that just goes $1.99, $3.99. What is it? It has it because I've then told them you have to attach the tags to the actual receipts. I try to go to stores that actually list what the item is. Am I correct? It's still similar to that?
That's a good idea, Deborah. To have it itemized is a very good idea. Because if someone presents a receipt with just the dollar amounts, we have no idea what the person was purchasing.
Well, I did that because one, I knew that because I also got this training from a community board because we are required to understand every kind of what programs are in our borough for any. So they always said you need, even like if say something happened and say like I had a house and the sewer pipe next to my house broke, I have to give them an itemized list with the correct receipt. Otherwise, you don't get a penny. Then I said, wait, that's like OPWDD doing that. So, because I know to make sure that the receipts, and I also, because I don't want anybody to accuse me of being fraudulent, I've started also to put the actual tag with and coordinate as best as I could. Some stores like Old Navy, when it was Sears was there, Alexander's did that, Macy's does that. For example, some of a lot of the shoe stores do it. So it's important. So I just want to make sure everyone understands we have to be so cautious how we fill this form out when we do it. Am I right?
Yes, yes, you are.
Okay. Does anybody have any other questions or comments?
Actually, there was one question that I think Angela wrote on the chat. Angela, can you just mention this again? To say, please remember the individuals can only receive. Can you explain that?
I couldn't hear your question. I'm sorry.
Oh, sorry, I forgot
Repeat
to
it.
put. No, that was my fault, Angela. Can you please put that? What the question you wrote said? Please remember that individuals can only receive up to $3,000. Can you explain that, please, very clearly? Because that was a question that's been brought up twice.
Any family support services that get reimbursement at this time, the maximum amount allowed is $3,000 per year. It does not matter if it's for camp, if it's for swimming, if it's for goods and services. You're only going to be allowed $3,000. Once they meet that cap, there will be no more reimbursement until the following year. Is that a bit clearer?
Yes. And
Yes.
I want to add in, Angela, that, and what you're saying is correct, and we'll get you in a minute, Doris, that New York City is on this different fiscal year than the rest of New York State. So Long Island, even though they're next to us, as well as up Westchester and Rockland, New York City's fiscal year is July 1st, 2023, or to, let me do this, July 1st, 2022 to June 30th, 2023. New York State, the other counties except us, it's April 1st to March 31st. So please, everybody, remember that. I saw Doris Khan, you raised your hand. You have a question?
Good morning, Deborah. Thank you. You answered it. I just wanted to clarify the fiscal year, the year that Angela's talking about. So in New York City, it's July 1st through June 30th.
Correct.
The year. Okay. Thank you.
Yes, because the reason I say that is I have families who tell me, well, my kid goes to school in Nassau County and they're on a different fiscal year, but you live in Brooklyn. You're in a different fiscal year. So that's why I want everyone to understand New York City is on a totally different fiscal year because of also the size and the funding we have. Doris, you have any other questions? None?
Just to clarify one more thing.
Sure.
If someone is going out of the city for, so reimbursement is based on their residential address, correct? Doesn't matter if the activity is out of the city, like if they go to camp out of New York City, obviously, yeah. I just want to clarify that.
Correct.
Yeah, or if some people go to even schools out of New York City, they're more specialized, whatever. I just want to clarify that. I know that, but I just, with all the changes, you just want to make sure that's still the same. Okay, thank you. Sorry.
Doris, when you mean going to school out of the city, explain that.
I really was referring to camp, Angela. I did not mean school. You are right.
Well, we only pay for camp within New York State.
Right. I was just thinking, I know somebody who lives in Brooklyn, but they go to school in Manhattan, but that's still New York City. So, but still it'd be based on where they live.
You're saying school. Do you actually mean school or do you mean camp?
Okay, the first case I meant camp. The second situation, I know somebody who lives in Brooklyn, but they attend a school, a special school in Manhattan, a District 75 school. It was the reason for that is because during Corona, they were short staff and they had to be moved around. But their residence, they live at home, is in Brooklyn, New York. So I just wanted to clarify that.
Okay, but we don't really pay for individuals to go to school for reimbursement, through reimbursement.
Right, I wasn't talking about school. I was just wondering.
Oh,
I
okay.
hear it.
Okay, all right.
I'm sorry. Sorry
It's
if I
okay.
I just wanted the reimbursement is for the individual for services given that individual who lives in New York City. That's
Listen, if you have any questions, just email us and we can clarify it for you.
Sure.
One way or another.
My questions would be case specific. So I just wanted to clarify for this particular family. No problem.
That is perfectly fine. As far as the receipts go, somebody mentioned it. I'm sorry, I didn't catch everybody's name. The receipts have to be clear. If you cannot read the receipt, then it either goes back or you don't count it for the reimbursement. It has to show the specific item. It has to show the cost. If it's a size 10 shoe, you have to make sure that that size 10 shoe is relevant for that individual. If it's a size 12 dress, is that dress relevant for the particular individual? Because I know a lot of times we get reimbursed, we get receipts that have several different items on it for several different children. So you have to break it down, if that makes more sense.
Definitely.
I second
And
that.
again, if you guys have questions or concerns, you can email us and we will assist you.
Yes, and they do answer your questions and they are trying to help us. But these updated changes have happened, and I appreciate the way Angela, Robin, and Janet have been here from
And
OPW.
Robin.
I did say Robin. Thanking everybody for answering these questions because it's I understand the frustration. I also understand the frustration that I've gotten parents who said to me their care coordinator doesn't understand how to fill out the form. That's why also I just put that a family should also know how. They need to know how to fill out the form. And I saw a question from Denise Jordan. Denise, you wonder what? Okay, you're not. No, Denise. Okay, the person who asked about if the child goes to a residential school, can either Angela, Robin, or Janet please again re-explain that if a child goes to a residential school, what is allowed or not allowed?
The individual, in order for anyone to get family support services, they must be living at home with their family, whether it be adoptive, biological, but it must be living at home with their family. They cannot be in a certified or residential facility, even
They
if it
have to
isn't
live with their
certified. They
family
have to live
full
with their
time.
family.
Full time.
Right.
Okay. Christopher, can you read the question that Lori put in?
Lori, can you unmute yourself and explain what you're saying on the question, please? So therefore we can hear you, because this question has been brought up, but I'd like to be clarified what you're saying.
Yeah, thank you. Please, Lori.
Lori, can you please unmute yourself?
Hi, yes, I'm sorry, I was
Okay.
munching on something. Hi, good morning, everyone. So 2 questions, basically. We are now able to, I'm sorry, let me get my thoughts together. I wrote it down in any case. So we have up to $3,000 per fiscal year. I get that. But how do we determine, and what I've heard is that we have to use one specific reimbursement agency. So how do we determine which agency to use? That's really the question.
Okay, Lori, this is Angela again. It is preferred that you just try and do your reimbursements to one agency. It makes it easier. It is not mandatory. It just saves you shopping around. You can still get the we're going to keep a copy of everything that's going on. So if you go to AHRC and then you go to YAI, we are still going to have a list of what you got during those time frames, how much it was, and how much you have left. So if you say, maybe just go to NICE for everything, as an example, they're going to keep a list of everything that you applied for. And once it reaches that $3,000, that's when it's going to stop. It's just trying to make it easier for the family so they don't shop around like we did in the last few years. Does that help you?
And then they can get
Yes,
confused
yes.
on which agency they applied for, which item did they
Right.
apply for and which agency. That happens often when they do that.
Right, that's what I was kind of,
It's
worried
this is
about as well.
Janet.
It's easier for you as the parent just to go one place instead of having to fill out documentation for 5 or 6 different agencies for, let's say, $200 a piece. So it'll make your life easier. And if it's
Right.
something that's not allowed, the agency is going to tell you, oh, no, I'm sorry, we can't process that. Or they'll check with us to make sure it can go through. But that's a suggestion. It's not mandatory.
Yeah, okay. Thank you. That
The
makes a lot of sense.
And you
Lori,
can always
Lori,
email me, Lori, if you have any questions.
Yes, okay. That was the basic. We've
Lori, I
heard,
just want to
go ahead.
Go ahead.
I just want to add to what Angela said, which is, a few years ago, when we had family reimbursement, we had different agencies providing reimbursement for different services. So we had camp reimbursement with one agency, transportation with another, general, reimbursement with another agency. So now all the agencies can provide reimbursement for all your needs. And that's kind of what Angela's saying. It's easier for the agency and it's easier for you to go to one agency and tell them what you need. Going to different agencies is really not going to help at all.
Okay, thank you. That makes sense because this way that one agency already has all of your information once you do the first time.
Exactly.
Thank you. Thank you.
Thank
Okay,
you.
thank you.
Thank you, Late. Thank you, Lori. We have a question on the hand raise for
Hi, this is
iPhone.
Jackie Tripodi
iPhone,
with
I'm going to
NYSEG.
click on your
What
microphone,
I
so please
also would
unmute
like,
yourself and
hi
please
guys, I'm on
identify
the phone.
yourself.
Sorry, I couldn't get on the computer. So here's what I'd also like to contribute to that
Hi,
in that
Jackie.
vein. When families are filling out their
Hi.
applications, please make sure
Okay.
that in Section 8, you indicate where else you have applied. I did have an example where a family applied to NYSEG and to another agency for the exact same item, for the exact same amount, for the exact same receipts. And I had to go back to them and say, what did the other agency process this? Did they not process it? So it delays the reimbursement process when that does happen because they were shopping around. The other thing is I had a family submit a second reimbursement. And quite frankly, I was confused if whether or not this was their first reimbursement or not. And they didn't indicate it in Section 8, which is the importance of families, and Deborah, back to your training, to know how to fill out this application. When they're going around to other agencies, it makes a big difference for us to process it. And that's why things do take time to do so. So
agree.
please, as you're filling out the application, if you're doing, say you did clothing in February and now April, you're going to go to camp, make sure you put that clothing reimbursement on that application and what the results were, so that this way we don't delay it and families know this is how we're working and we're trying to work hard to get this done. So thank you.
Thank you, Jackie, and good to see you. Appreciate, no, that was very important because I've also told families be cautious about how you apply and where to apply. So this is important. And care coordinating agencies that are here, please tell your care coordinators, and they have to list if they also went to more than one agency so that the DDRO can figure out and the agency that does the reimbursement knows what's going on. Okay, I see Marilyn from Care Design. Which unmute, please. You have a
Hi,
question?
yeah, not a question, it's just a comment. If it's a family that we've been providing services, then we do keep track of like which agencies we've used for reimbursement. Sometimes it's transferred from other CCOs and the family don't let us know. So the care managers are finding out as the provider is responding back with like, no, we won't be able to reimburse that.
Okay,
I'm a little confused by the question.
it's more of a statement. What she was saying is that they get parents that okay, hold on a second. All right.
I'll try to explain it, Deborah, again.
Go ahead.
Like, I'm listening to the working with different agencies for family reimbursement. If we've been the care managers for that person for a while, of course we keep track. So we will let the families know, like, no, we can't submit it. You have already maxed out, or you've already used it at X, Y, and Z agency. However, one situation that happens is when they come to us in the middle of the year and we're not aware that they have done reimbursement themselves. We as the care managers do find out at the same time that the agency are responding to us.
Yeah, I don't know that you can avoid that.
Mhm.
I get it. I'm sure it doesn't happen all that often with the new
No.
process, but it will come back to the care coordination agency and the family because the DDRO is keeping a record of everything. So if
Yeah.
Family Smith applies for camp from one agency and you're not aware of it, and then goes to you and says, could you apply to X, Y, and Z agency for an adaptive something? Eventually it'll come back to you that,
Yeah.
yes, they can get it, or no, they haven't because they've reached their cap.
Yeah, so that's the only unfortunate. Like we only know once we hear back from the provider
Right.
agency of the
But
state.
we haven't heard that. So is that happening a lot to you?
I can say 2 families in the last 3
Yeah.
years. 2
Oh,
families.
but now the system's different, so it may not happen.
Well, yep, that's true. Probably not, but still, we still need to get on it. Isn't it supposed to be listed in their life plan? So maybe they should also have your care coordinators go through the life
Yeah,
plan
we've
like
been
it's
doing
a Bible.
we've been checking choices to see because not every life plan that we get from another CCO has that.
Uh-huh.
3 or 4, yeah.
Yeah,
That
I'm
is a
going,
problem because
man.
if they have waiver and they have a life plan, the actual item doesn't have to be listed in the life plan, but the relation to the disability does. So if someone is asking for swimming lessons and throughout the life plan and a doctor or someone writes that they have poor muscle tone and they need exercise or whatever, it could say in the life plan that they have poor muscle tone or whatever, looking for activities. It doesn't have to state swimming lessons, but there has to be a connection. So things do have to be in the life plan.
That's helpful to know.
Glad to know that too. Very important. See?
Excuse me, guys. There is a question on the chat on the private section, and this is actually a thank you for Janet, Robin, and Angela Blades. They're actually saying thank you, ladies, because you are young ladies. I can say it. They're saying thank you because this information makes more sense what you're all saying. We in the community saying thank you so much because you guys are explaining to us. We really appreciate this and we feel very happy. Again, they're writing thank you at the bottom of their hearts, and they, if any concerns, they want to say thank you. Also, they also want to thank Care Design because Care Design, they said they took your advice, Robin and Angela and Robin. They said they went to Care Design. They're getting more courtesy and help faster than the other 2, which we already know. We only have 3, so you guessed that one already. So this is a thank you very much. And that is the last chat in the question.
Okay.
Now,
Okay, does anybody have any other questions, comments, or concerns? Because this is
Dolores just wrote thank you again to all 3 ladies. That one is actually on the main chat area.
Thank you.
And I also know Lori's putting thank you as well. So
well, Lori put something else in.
yeah.
Lori, unmute. I want you to read that. Please. Lori, come on. I need.
Give her a second.
I'm giving her a million seconds.
Yeah.
I'm being patient, but I like the question.
I'm sorry.
No
I'm
problem.
not good at video, so yeah. So my question is, how are care managers being told about all of this? Because not to out anybody, I've heard that several of the care managers, because I deal with different people and different people that have care management. How are they being told this information? Because some of them don't know any of this. One person told me, well, I'm getting my information from you, and they were talking about me, because I mentioned when I first heard about the reimbursement and, about the reimbursement criteria. And she's like, oh, I didn't know that. I'm like, and this was what? I mean, yeah. So how are they getting their information? That's my question.
Okay. Who wants to take this?
I'll take it. It's okay. There was training when the ADM came out. There was training for the 3 care coordination agencies. So they should have gotten the information from there. Also, their agency is responsible to keep up with this stuff. In other words, if there's a new care coordinator, the agency should be training that coordinator in the new process. We do get calls from case managers. They don't know which end is up. They're new or whatever. And we do try to help them. But there has been training. And as either Angelo or Robin said, there will be another training coming up. We just don't know the date yet. So, but again, it's the care coordination agencies that are responsible to pass this information on to anyone who's new or has a question. There was a training and there will be another one.
Does that answer your question, Lori?
Yes, thank you.
And
And at the
Lori?
time, it was like last month that
I
someone
understand.
mentioned that to me. A care manager mentioned that to me.
Well, you
So-
know what? One of the roles of the advisory council is when you hear that, let me know, because one, and we're not trying to get the care coordination agencies in trouble, but we want them to understand all the ADM changes for reimbursement and how to do it. And we understand it's overwhelming, but at the same time, they need to let us know, because if they're having problems, we can't help if you don't talk to us. And we will advise you, and we ask you to also contact OPWDD, ask the family support coordinators and the reimbursement coordinators. They're very happy to help reach out. They want you to be able to help the families fill the form out. They want these services to continue and last. So we do need to work with each other. If you're having issues or not sure, reach out to OPWDD. That doesn't bother me. I like that, because I want to make sure we keep these programs in existence. So thank you, Lori, for bringing that up, and thank you, Janet. Do we have anybody else who?
Yes, can I make a comment regarding that, if you don't mind?
Sure. No, go ahead.
On the OPWDD website, there is a link for the training. It's a YouTube link that was when we did the training previously.
Yes.
So any care manager, any family can go on that link and watch the training. The only thing that's probably going to change is the allowables and the not allowables, but everything else is still basically the same. So you can always email them, have them email us, and we'll send them the link if that's what they need to do. Or they can just go on the website and they can get the link under the OPWDD FSSADM. There's a link right under there. And it's a whole video that they can watch.
Angela, this is Chris. Can you
Thank
please?
you.
Oh, I was just going to say, you guys put that on the list, but then I could say, oh, no, it's Doris Khan throwing me off. Can you send that link? Because it is on our website. I just updated the other day. Also, so I'm glad you're saying it. But I remind everyone, this is also available on our website as well. And more information is going to be more up to date soon. So I remind everyone to please keep close on the OPWD page as well as on the website. Thank you, ladies.
Thank you. Thank you, Angela, for saying that. It is very important, because we professionals and parents, we need to look at the trainings and try to attend whatever you can and try to absorb it. And if you're not sure, then you ask questions. There's no question is stupid. Every question is valuable and important. That's how we make change and we fix things. So I thank everybody. Now, we don't have any other questions?
No, we don't, Madam Chair. We're good.
I just like to let everybody know I did put the link to the ADM and the guidelines for reimbursement in the chat. It says 2023, so it's there if anyone wants to look at it.
Robin, I thank you very much, because I did watch the training and I thought it was excellent. But the problem is with even before we made the changes with the ADM, everybody still had questions. Is this allowed? That's not allowed. So honestly, it's still a work in progress, but we're going in the right direction. And I do appreciate that you were here today. I do appreciate Angela's here, and I also appreciate Janet Davis is here, because this helps us, because I want to make sure that the agencies can do the reimbursement program and the families can get the help and services they need. So I thank you. Nobody else has any questions for our three?
No, we're good at this time, because there's no one has raised their hand. There's no more questions in the chat. I think everyone is question out.
Okay?
And Madam Chair, Madam Co-Chair, we do need to we have some other updates that we need to let the people who are on right now to know the next meeting is very important also in this month.
Yes, please do.
So can we just move on to there? Because I have to step away for a few minutes.
Yes, let's do this.
Yeah, first of all, I want to thank the ladies also who are here. Thank you, all three. Actually, now because a lot of questions was answered, so we thank them so much. And the attendance number was actually higher than we ever seen. So I think this is a wake-up call to wake up 2023. So let me just move on quickly onto this. To remind everyone, the next meeting is April 12th. It is the next Family and Provide information. If you have a topic or if you have a topic you want us to bring to our attention, please let Deborah or Rosal know. I remind you, their information is on their emails or on the website as well. You can always email to the advisory email or deborah.61@yahoo.com. That is her advocate email. So therefore, you can respond to there as well on that as well. I'm going to move on to news update because we do have some serious business, and I'm going to ask Deborah to bring up one piece. Before I do that, I want to remind everyone our phone number is there. Please note this, that Mrs. Menino, who is the executive assistant to the advisory council, does check the voice message. But I want to be clear, we have received a lot of calls. I understand that. We do get back to you. But if you do not speak clearly or do not give us the number clearly, we cannot return your call. Also remind you, that's why we have an email address that you can do that as well. I'm going to ask Madam Chair to hold that thought because you're going to bring this up as well. The next joint meeting, we're going to be having all three CCOs at this meeting. And this is the time between this meeting and, as you know, some of you did attend the legislative 5-borough. I know some of you may have issues or concern. If you have any questions and you'd like to bring it in today, please let Deborah know at this time. So I'm going to ask Deborah to take give Deborah at least 5 minutes to give this update on the CCOs. Plus, I know, Lori, part of your CCO question is related to this meeting as well coming up. Deborah, can you please explain this?
Sure. The reason why we are doing this at the next joint meeting, which will be next week, Wednesday, March 15th, is for a reason, because we get a lot of families complaining to us about their care coordinators, or nobody gets back to them. So we take this very seriously, and we've asked all three care coordination organizations to be there next week to give us a brief. What is their policies to get back to families? How do they help the families? If you can't reach your care coordinator, who do you reach? Who do you don't reach? And we understand the issues. And actually, we do understand both sides. We do understand there may be issues with the families. But as I say to every professional, remember, when you have a child with developmental disabilities at home living with you, and they can be very challenging and it's exhausting, we parents need all the help we can get, because our children have their own major and unique challenges, and that's why they qualify for services under OPWDD. So our Vice Chair, Brian, has asked all three CCOs to come. We ask everyone to please try to sign in between 9:30 to 9:45 so we can start on time. Parents and professionals, if you have questions or concerns, please have them ready. And then you can bring them onto the chat. You can raise your hand. And as I said before, no question is dumb. No question is stupid. Everybody's questions are very, very important. Now, if you notice that, yes, we had this past Friday, the 5-borough legislative breakfast. Now, these are they've been asking is, as you see, it says the budget priorities for Department of Health, budget priorities for State Education Department, Disabilities Advocates, the budget budget priorities and transportation. Please bring it, try to bring or meet or even email these or forward these information and your concerns to your local elected officials. That includes, you can do the city council because they do get money toward the budget, and many times the city council shares the office with the state. That would be the assembly and your state senator. And they need, or everybody needs to know if we're having issues with the education issue, also Department of Health, budget priorities, and also for transportation. And we also need to make sure that OPWDD is funded correctly. So as you see, you can click here. We also, if you want to view the session, you can click there, and we have it attached to the website for www.bfssac.com. So we do have those ready for you to bring up. But as I said, next week is a very, very important meeting. We're having a lot of families who are having issues. They're very upset with how care coordination is going. So we're going to ask all three, again, I'm repeating, all three CCO agencies, that's ACA, Care Design, and Tri-County, are going to be doing a presentation. Please have all your questions ready. Have everything if you have to. If you can't make it to the meeting, which I hope you could, you can email us and we'll try to see that they get the questions and we try to get you your answers. So we're hoping everybody can be there next week. So does anybody have any questions, concerns for me? Need me to know anything?
Just to remind everyone, this question is right now we're picking up the legislative breakfast because there's been complaints that people had a hard time getting on. We are aware of that. And I want to remind you that the DD Council, as Vice Chair of the DD Council, we have no control of that 5-borough legislative breakfast.
That's true, we did.
The video is there on our website, is on the homepage, and it was sent out the link. If no one got the link, please email us to the bfssac@yahoo.com. I'm going to be a little quicker because just to remind everyone that this is not just one thing we need to be alert on to let your officials know. We also need to just to let everyone know that we need to remind the elected officials the MTA accessibility is still linked to this as well. We need to remind all officials to please to make sure funding is covering for accessibility to all MTA, from Accessori to the elevators, to the Long Island and Metro North cares, and much more. So please make sure you do your part is letting them know as well. Transportation is related to this as well. Covert information at this time is, because let me go faster, then Ms. Graff will add her comments in a little bit. Let me just speed up. The comments here, remind you that you can check our information on the COVID updates as well as the flu, and any other information you're looking for is available. Keith is the one who does the community affairs. Department of Health and Mental Hygiene does give an update. The update has been updated, and any new information you need to find out or questions, you can email him and he will get back to you. We'll remind you that somebody asked me this question. The transition committee is coming up on the 16th. So this is their code. Their information as well as provide information is also on the website. Also, just to remind you, we have added additional new customer centers. Coney Island is the first one with Atlantic and Yankee Stadium. Now we have to add Penn Station on the 1, 2, 3, Main Street Flushing on the 7, and St. George and Staten Island Rapid now has it. So instead of you going looking for the vehicle or go to Stone Street, you can go to them as well. As a remind you, they're open 24 hours, 7 days a week. Redesign, going to remind everyone there's one more left, District 18. We're asking everyone to please attend. Hope to everyone to see you there. If you have any questions regarding bus stops, curb cuts, and stuff, please speak to Edmund. This is his information. Email him, and he will get back to you. I remind you, also please put that into 311 and then email him your complaint number as well. And to remind you, MTA is still doing the Omni presentations. Some of you did attend, but some are still asking me, how can I do it? This is their link. please make sure you do that as well. And to remind you, our website is available as well as we're on the Facebook and Twitter. Please make sure you go onto our website, get any information you need. If you have something new, please do that at this time. Now, Madam Chair, there were some people, Madam Co-Chair, there were some people did not have announcements, but I know you have a question. Can you please say your comment?
Yeah, there was one more thing that we want everyone to vote for and let the legislature to know. We want to make sure that people who are on committees, like local and state, citywide and statewide, that we still can continue to meet virtually, especially because we families of the statewide have children with developmental disabilities, and we can't always get to a public place because our child may be sick or could not go to their program, and we need to stay home. But we want to participate, and we want to be it to be considered a quorum that we are there. That's what we're asking. So please let the elected officials know to please advocate for that. Thank you. Okay, with that, if we have no more questions or concerns, I want to thank everybody who participated. I want to thank Robin Mooney. I want to thank Janet Davis and Angela Blades for all your help.
You're forgetting someone.
And who else am I forgetting? Christopher Greif?
Oh, you forgot Dolores Kahn.
And who else?
Dolores?
I'm thanking everyone who appeared today.
Yeah, but you're forgetting Dolores Kahn. She had an announcement, but her mic wasn't on.
Sure. Doris, you want to make your announcement?
Hi. Wait a second.
You're on.
Hi.
We got you.
Yeah, I'm Doris Kahn. I'm the outreach coordinator for New York State Institute on Disability. Since our topic was on reimbursement, just most of you know, but those who don't, NYSID provides reimbursement for goods and services and camp. And for more information, to contact Jackie Tribodi, who was on earlier, at 929-202-1115, or you can email jtribodi, TRIPODI, at NYSIDinc.org for more information about your reimbursement and application for reimbursement. And I put all that information in the chat already. Thank you very much, Deborah and Chris.
Thank you. We appreciate you. Thank you. Nick, are you still here from PHP? Is your system working? If you want to try to do your announcement again. Okay.
Yeah, I'm still here.
Okay, you want to try again? Let's try again, okay?
Are you hearing me okay?
Now I'm hearing you, yes.
Okay, good. So in 2023, we started a new benefit of an OTC card, over-the-counter card for pharmacy-related items. And this benefit is for people who live not in a certified residence, but live on their own or with family. And it's $150 per month. And you get a debit card. It's replenished each month and can be used for a whole list of OTC items, over-the-counter items, as well as healthy food items. So it's a nice benefit. There's even a way to order things online to even have fresh fruits and vegetables delivered to the home, as well as pre-prepared meals that just have to be reheated. We also did expand our non-emergency medical transportation program that previously was just for going to medical appointments. And once again, this is also for people who do not live in a certified residence, so live with family and on their own, and takes them to and from medical appointments, but we expanded it to not only going to the pharmacy or grocery store, but also to volunteer opportunities, to the gym, and up to 24 social events per year. So it takes the person door to door. You just have to make the appointment 3 days in advance. And they use other taxi and rideshare programs to provide this service. And there's no one else in the vehicle. It's just, you advocates as needed, and of course the driver. So My information's in the chat. And if you want to reach out to me, please feel free to do so. My phone number is 646-771-3184.
I have a question for you, Nick.
Of course you do.
Yes, me not have a question. Okay. Is your vehicle able to take someone who uses a wheelchair or a walker?
Yes. Good question. And when you make the appointment, like I said, it has to be done 3 days in advance.
Okay.
You could do it, you can make a phone call, but you could also do it online, and you could even schedule things recurring. So if you had physical therapy every, Wednesday, or wanted to go food shopping every Tuesday, you can set that up for weeks, months in advance, every week, or, what your schedule is. And to answer your question, if you do have a specific need, like a wheelchair vehicle, you would put that in there and they would get the appropriate vehicle.
That includes a walker too.
Yes. And another nice thing is that, yes, we provide doorstep to doorstep service with this, but if there's, curb to curb service, but if there's even more of a need where someone needs to go to the physical door to help them open the door, go down the stairs, that can also be accommodated. So those are the things that you would just have to put in the transportation request.
That's great to hear. Now, my other question: are you taking patients or individuals who use New York HHC hospitals?
No, not yet.
Well,
still not in our network. That's a long-term goal, a long-term affair.
Well, we're going to push, because now that we can go in person, we will be sending you the list of when their public hearings are. And that would be very important, and they're doing it in person, that we get that done, because you see, many of our individuals go to the city hospitals because they're closer, and they've been going there since they're children, little kids. Because they used to have child development centers in everyone, but now it's only one per borough. So it would be a big help. So we'll make sure you get that information so we can advocate.
Great.
But thank you for letting us know, and I thank you for updating. When you do send us that information, do you have the list of what stores accept it and what stores don't?
I don't have that list.
I know you don't have it now. I said when
available.
you get it,
okay.
Please email it to the advisory council with your update with that, so that we can make sure families who are already using your service know and understand it. So it'd be, I didn't say you would have it now. I know that you wouldn't, okay? But thank you for letting us know. I appreciate it very much.
Okay,
And Nick,
thank you.
Appreciate it. Thank you. Anybody else have any announcements they want to make? Raise your hand. Or for now, if nobody else, all right. I want to thank everybody who came and participated. Again, I thank Robin Mooney, Janet Davis, and Angela Blades from OPWDD Region 4 for help and understanding what's the way to do it. I also thank all the groups. I thank the CCOs and PHP for coming. And of course, the most important were the families and parents. So since everybody we hope that we see everybody next week at the joint meeting, as well as anybody who wants to go to the transition. As you know, you can always go on the website. As you see, you can email us at the BFC. We have the contact. I also want everybody to be aware, and I'm saying this for public record. That is a phone number. You leave your information. Please make sure you speak slow and clearly. Please let us know. Please repeat your phone number twice. You can also email us, and you can also go on our website. But please, we are parent volunteers, so we'd appreciate. We're all trying to help, and we thank everybody who came. So everybody, Please have a great day and stay warm and safe. Thank you. Bye, everybody.
Thank you, Deborah and Chris.
Thank you, Janet. Thank you, everybody.
Bye.
Thank you.
Bye.
Bye.
Bye. Bye, everybody. Thank you.
Thank you.
Robin. Thank you. Thank you, Zadina. Thank you.
You're welcome, Deborah.
Thank you. We appreciate everything. Thank you. And I hope everybody got their answers as much as we could. We did the best we can. Thank you. All right. Saying goodbye, everybody.